Pudendal neuralgia is not gender specific, but it's often missed in men as infection. Pudendal nerve is a nerve that exits the sacral area, the back of your pelvis, and it goes on the inside. You can see the yellow here. It goes on the inside and it goes through this mountainous path, going through these tight orifices to come out to the external genitals. So that would be the penis or vagina. It can be the anus in the back or the space in between. Pudendal neuralgia is a nerve-related pelvic pain that can cause burning, numbness, or sharp pain in the perineum, in the penis or scrotum, or in the rectal area. Diagnosis often requires really listening to the patient to hear what they're saying, which in my opinion is not happening enough. Some of the common symptoms in men are pain that worsens with sitting and it goes away with standing or lying down, though in severe cases it's still there when standing, especially in men because of how a lot of times they work out or they walk. I'm going to get into that. That burning and numbness or electric sensation in the perineal region and at the penis area is a common symptom, and pain during or after ejaculation or bowel movement. Those are some of the common symptoms that men have. It does come on with urine or urinary excretion or bowel movement as well. Pudendal nerve is a nerve that provides sensation to the penis, scrotum, that area, the genitals, anus, and the perineum, and it also is in charge of the external sphincter related to bowel movement and urinary flow. Gotta understand that there is another nerve that we're not going to discuss here that's in charge of the involuntary functions of those areas that have to do with your autonomic nervous system. Back to pudendal nerve. When it comes to pudendal neuralgia, we can't just assume that the sensation that we're having in the front is the only aspect of the pudendal nerve that is being irritated. It can also be from the course of exiting the back, going through the path to come out. So what we want to look at is what is causing irritation of this nerve and how can we get rid of it. When it comes to men, a lot of times they overwork out. They do workouts that are beyond their abilities, so they end up bringing in other body parts, clenching their butt, tightening the base of their penis to try to lift to do whatever it is that they're doing. That is very common. When I watch men walking, I can see they have patterns of movement, bringing the clenching of the butt, the tightening of the perineum, even when they're walking. A lot of times that gym behavior comes across all activities and it gets accentuated by repetition. When it comes to pudendal neuralgia, we can have issues with the exit point from the spine, and so we need to look at it. So you can have chronic back pain, you can have chronic SI joint pain, poor posture, sucking your tummy in, kind of clenching and holding your breath, over activating your abdominals. All of those lead to the dysfunction of how stable the connection of the spine to the pelvis is. That instability can very much irritate that pudendal nerve at the origin. So now we're looking at a pelvis that's unstable. Unstable pelvis means tension of the muscles on the inside. You see, these muscles are voluntary. They work with the environment outside to provide stability. When the stability is not coming from the outside, the inside muscles have to overwork to compensate. The double enforcement of the muscles exists because the stability of the structure is so important. Everything above relies on the stability of the base, and this is your base. So when the muscles on the inside get tight, whatever resides here is going to be compromised. It's only a set size. When the muscles get tight, your pelvic organs are going to be compromised. That's your intestine, your bladder, your prostate, and the tubes that allow them to exit. So the tubes that go through the penis, ureter, as an example. There are arteries, veins, nerves. Pudendal nerve is a great example. Then there's muscles, there is joints, there's ligaments. So everything that resides on the inside is a fair game because it's being compressed. Irritation of pudendal nerve is what pudendal neuralgia is. So how do we go about dealing with that? In the medical model, for one, they keep pushing it and thinking it's infection and treat it for the wrong thing. Then you go and do pelvic floor therapy. They go on the inside, they try to reach it, but it's still not fixing the problem because this was not the fix to begin with. The dysfunction still exists, the instability still exists, time passes by, so now they do the nerve block, which may or may not work, and even if it works, it's not going to take away the instability that was the cause to begin with. So how do we go about to deal with this? We need to listen to our patients. We need to hear the story, translate what is being said to the body part that is being distressed by it. In my practice, I watch their gait, how they walk, how they perform certain movements. I'm looking for instability. And I look at pelvic stability to be present. Or is the pelvis providing the job it's supposed to do? Or are you using something else? Because that's all different patterns of movement. How do we go about fixing it? We start with biological breathing. If you had subscribed to my channel, you know exactly how biological breathing is done. That's a term I came up with. It's inspired by studying human babies. Every single one of us were born breathing the same way, and we did it until we became dysfunctional. At the first sight of dysfunction, if we did not have the ability to compensate, we would all die because we didn't have another way. The good news is that was not the case. But that was the beginning of dysfunction. So biological breathing is what we bring back into the picture to increase our batting average. If you don't know how that's done, I'll make sure that we put it at the end of this video, but make sure you subscribe to the channel. I post very regularly because I want you to be educated. I want you to solve your problem. I want you to take control. Then I use developmental exercises, the same exercises that allowed your whole body, including your pelvis, to become stable to begin with. It has worked over and over. Every single child that's born becomes a running toddler. No bands, no gyms, no weights, no guidance whatsoever. Your brain knows what to do. Your body parts know what to do. You have created an environment that does not allow them to do what they need to do. Change that environment, and you'll see the result. So it increases your batting average tremendously because it's a proven methodology. So we use developmental exercises coupled with biological breathing, and the most important part is you recognizing what right looks like, what your version is, how to replace your version with the right, and how to safeguard it, and if you violate it, how to bring it back. So that means as the owner of this body, you need to hold the information and you need to safeguard it. So then you don't hopefully need people like me to show you the way every single time you are unstable in any of your joints. That includes your pelvis. Thank you so much for watching. Thanks for subscribing. And make sure you use one of the methods of contact in the description box if you need help. Until next time, take care.